Hello there, I'm Miranda and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hello, my name is Clare. I am a community learning disabilities nurse for South Norfolk, and I've been in the job role for 18 months, but I've been in the health service for 27 years in total.
Hi, I'm Natasha. I'm a diabetes and tissue viability specialist podiatrist. I work in the west of the county. I've worked for the trust now for 13 years.
We're here to talk about perimenopause. So let's hear about your experiences. Natasha, do you want to tell us first off how you came to understand that you were going through the perimenopause?
It was about 5 years ago. Now I'm 48. I actually work with endocrinologists, and I'd had erratic periods for maybe a year or two, and I was only 42, 43, and I thought, I don't know if this is normal. So I asked my mum, and she was very much, I don't know, I don't remember any of that. My sister had a surgical induced menopause because she had to have her ovaries removed. So I didn't have anyone to really ask, because so I actually asked one of the endocrinologists I work with, and he pretty much just turned around and said, "You're too young. It's not happening. There must be another reason." So I went to the GP initially, and I said, "I don't know what's happening," and they're like, "Oh well, see how you get on," and that was it really. And then maybe 2 years down the line, I was actually at a training course, and the trainer was going through a PowerPoint on how we can support our patients with diabetes who have depression and anxiety. He had this long page on a checklist of things that you go through, and I sat there and I went, I have every one of those. And I actually was at the front, and I was crying reading this as the realization hit me that this is what's been happening to me. It took another couple of weeks until I got enough courage to actually go to my GP again, and out comes this young male GP who I'd never seen before, and I thought, oh no, he isn't going to understand. And I have to say, he was the most understanding, kind GP. He went through everything. We spent ages talking, and I said, well, am I in menopause? Is this and he actually told me what the difference was between perimenopause and menopause, because I had no idea. And he recommended I have some CBT, and I went along to actually Wyndham, because that was my nearest one, and that was part of the well-being service, and it just taught me how to cope with my symptoms. I mean, it hasn't been easy, but going to talk to them and realize that, one, I'm not losing my mind, this is normal. Yeah, that all helped.
Claire, what was your experience? Did you find that you hit some walls when you first went talking about it?
My periods were very, very heavy, to the point I was very anemic, and my iron store levels were down to about 15 a lot of the time, even though I was taking iron. So they put me on the Miranda coil, but I just found I get reactive depression anyway, but I found my depression was getting worse. I found I was getting hot flushes and getting more tired, but I went to the doctor, and the doctor basically said they couldn't test it because if they took a blood test, it wasn't accurate.
Yeah.
So I found I got more or less rebuffed. So I wasn't as brave as Natasha. I kind of gave up on it. Certainly, I meet a lot of the criteria: concentration, forgetfulness, the hot flushes at night time, the sleeplessness, the broken sleep. And I've had that for years, and that's sort of just become like a normal for me, really. So, yeah, so I was kind of rebuffed, and it wasn't really recognised. for what it should have been, I think. So
Interesting. And you haven't been back?
no, I haven't been back. But I might be after this, actually. I might go back now. You've inspired me.
I think that's a really good idea. I mean, what was stopping you from going back? Like, you obviously you were rebuffed. Was it literally just that you were like, well, if I go back, they'll say the same thing? So what's the point?
Basically, what is the point? Because I'll just go back and they'll say the same thing. So I know a lot of friends who are going through it, and they've suffered very, very badly with depression and things like that. And I think it's very undervalued and uneducated area of health, isn't it, really?
There's also that stigma, Claire, of being a healthcare professional and admitting that there's a problem that you can't deal with as well, I think.
Yeah, absolutely.
I think I need to go back to my GP and maybe start on the HRT, because I'm getting a lot of the symptoms again. And for quite a long time, I felt brilliant. I actually felt like the old me. And I was thinking, yes, I'm over this. This is like, and then I had COVID and my periods like kick started again, whereas I hadn't had one for about 8 months. It's all come back, the fatigue, the aching, the memory loss, the
memory loss.
What day it is, and not even remembering people's names who I know really well. That's the bad thing. Thankfully, it hasn't happened at work. I know how to work. I know what I'm doing. I know anatomy still, but yeah, it's hard to admit, isn't it, that you're not perfect, as it were.
Yeah, that's an interesting side to it, isn't it? Because actually at work, you're, like you say, you've been doing this for a long time, you know your job, and you want patients to feel safe and comfortable and know that you're doing what you should be doing. And so if there's ever any kind of brain fog and you forget something, that, it must be quite scary, I guess, to admit. But again, it's around the sort of stigma of talking about the menopause and perimenopause and periods and all of those things that we've sort of been told, don't, oh goodness, don't talk about them. Because if you were to say in a meeting, oh, sorry, I've lost my place, or I've got a bit of brain fog, because I'm going through the perimenopause. Is that something you'd ever say? Do you feel comfortable doing that? No.
Even though, I mean, the podiatry department is predominantly female and older, I would maybe 1-to-1, but I wouldn't in a meeting. No.
Isn't that interesting? Because there probably could be 2 or 3 other women going through the same situation, and yet we're opening up the conversation, but we're not quite there yet with talking about it in those forums, which is totally fair enough, I think. So yeah, I think the symptoms are really interesting to me, because every woman I speak to about perimenopause has a different set of symptoms, and I think that's something that we do underestimate quite a lot of the time, that every woman goes through it in a different way, and the symptoms that affect us mentally are something I think we don't talk about always. There's a lot of focus put on the hot flushes and feeling different physically, but what other kind of symptoms have you guys felt in terms of that sort of brain fog that you're describing, and depression, anxiety, things like that? What is there anything else that you've been experiencing?
I've found I've got more anxious because I sort of worry I'm not going to perform at work, and I worry that I'm going to look silly. And I think generally, is it a female thing anyway? So when you have children and you're pregnant, you're expected just to carry on, soldier on, and everything else. Yes, everyone makes a joke, oh, you got pregnancy brain, but actually, if you're in a registered nurse or professional position, you're expected to do your job, aren't you? And that is expected of you all the time. So you're pregnant, then you have the child, and then you sort of bring up the child and work. And I think it's just a mentality that's carried on throughout the years, and women just cope and we just get on with it, don't we? Because we're just expected to perform our professional roles well and effectively, and to a high standard, which is fine, but sometimes it can be very difficult throughout our life for women. So for women particularly, men do have changes, but women's changes are very, very drastic, I think. And we just, like I say, the attitude is just get on with it. It's normal, it's natural, that's what happens.
Yeah, and interestingly, that attitude is one taken by quite a lot of GPs,
Yeah.
that it's just there's nothing we can do. That's just what's going to happen to you, and you have to get on with it. And you know, in the
Yeah.
workplace, especially in a profession like the NHS, it's very difficult sometimes. You know, if you're a community nurse, or you work in the inpatient ward and you're working with patients, you're wearing the PPE. It's fast paced. There's a lot to remember. It's very difficult to manage that, I would imagine. How do you find it with patients? What kind of experiences have you had?
I can't remember anything that happens at home, but like my brain has prioritized. I need to remember about work, and I need to remember this stuff. And I mean, you do things like writing things down. I use a system on tasks. You use little things, but I do think that my home brain sacrifice is a sacrifice for my work brain, because I feel that, rightly or wrongly, is a priority. I think the effect of those symptoms also brings a lack of confidence. And it was one of my managers, my male manager, who I don't see that often, and he actually said, in the middle of me going through everything, he said, something's changed about you, that people have noticed that you're not yourself. And I just said to him, well, I'm having some therapy, I'm working through, and I haven't asked any more than that, but I think it was because I wasn't as confident, and everybody knows me as being quite confident in my abilities and my knowledge that I am, but I just had lost that.
How did that make you feel when he said that? Were you a bit offended by that?
Part of me was glad that it was being acknowledged, but no, absolutely, part of me was absolutely horrified that it had leaked through to my work life, that people had noticed. So yeah, it's difficult, because not everybody did say anything. I mean, thinking a lot how we say grumpy old women and grumpy old men, and I do think I am turning into a grumpy old woman, and I do think that is after perimenopause, that you think, well, life is too short. I need to get on with it. I can't be dealing with time wasters anymore. So yeah, I think I've turned into a grumpy old woman. That's what it is. I'm 48.
I think I've always been a grumpy old woman. I quite enjoy being a grumpy old woman, to be honest. I'm only 39, so. Claire, have you had a similar kind of experience in your team? You know, with how you're coping with it?
It's like you saying the grumpy old woman thing. With me, I'm fine. I'm not getting so grumpy. I just don't have the energy for people anymore, and I don't have the tolerance. I've got so much energy, and that's all I can manage. So if I go on a visit, obviously, like the adults with learning disabilities and their carers and their families are priority. So I do that. Then I come home, and like you say, my memory's gone for home completely. It never was that great, because I've got dyslexia as well, but it's just completely gone. So the kids are constantly reminding me, have you done this? Have you done the other? And I end up getting snappy and saying, well, when do you think I'm going to find time? I do this and I have to work and everything. And the poor kids kind of get it in the neck a bit. But because I'm trying to because I'm just tired, and I get tired of concentrating. So one thing I have found is quite funny. I've started doing this dance class on a Monday evening, and that's quite funny. So women in their 40s, and I'm sitting there dancing to Paula Abdul, which has made me feel a bit better.
Oh, I love that. That's a great idea.
Yeah, I like that. I can't keep up with the routines, but so I found that's all helped a bit of exercise,
definitely.
doing something different, something for myself. I don't know about you, but I think I've got to the stage of my life. I think I've given a lot of my life to other people, to bringing up a family, and want a bit of my own time back.
Yeah,
it's really interesting that you both say that your brains have sort of somehow, without you trying, have prioritized work over home, because it's almost like that instinct that something has to give because of what's happening to your bodies at the moment, and the thing that is giving is the home life, and therefore, as a knock-on effect, yourselves. And I think as in a caring profession anyway, priority for yourself is way down the list. But obviously, clearly, your brain is doing that for you at the moment. And so the fact that you are refinding something for yourself, Claire, is great. Like it's a real inspiration to women to say, well, actually, no. Do you know what? I'm going to recognize that what I'm doing is prioritizing work, and therefore my home life is maybe, not so much suffering, but is taking a hit. And so I'm going to do something about it. I'm going to go to a dance class, and I think that's fantastic. I wonder whether a lot of women are doing that, sort of subconsciously. You're on autopilot, aren't you?
Yeah.
Making dinner, putting the wash on, running the hoover around. It's all stuff that you don't necessarily need to give that much thought to. So
Yeah.
that is the area of your life where things are going to naturally be lower down the priority list, I guess.
Yeah.
How have your families coped, your partners, your kids? How are they coping with what, do you talk openly with them about what you're experiencing?
I have two. I have an older son and a daughter, and then I have a younger daughter. My two older kids, who are 23 and 19, I have been quite open with them, and I've talked to them about it. And it's especially my son, because I said to him, it's important that you understand. My daughter obviously will come to understand eventually, but my son, I really want him to know, and he can see when I'm tired and I've had enough, and he'll be like, okay, I need to take over a little bit now. My husband, I have to say, has been amazing. He puts up with me being annoyed and frustrated at the fact I can't do something because I just physically can't think how to do it, or my joints are aching, or I just can't remember something. So I have to say he's been amazing, but it took me. It wasn't until I went to the doctor and I told him, and he was amazing, and he actually said, you need to tell your family about this. I actually sat my husband down and I explained it, and he obviously had noticed that there was a difference, and that I was angry and annoyed and all the time. And so yeah, I have to say my family have been really supportive.
My husband's been very supportive and understanding. I can go, oh, I'm getting hot. He'll open the windows and he'll get the fan down. Things like that. He's very good in that way. My older son, who's 23, is very good, and you can see when I'm tired and he'll just take over and cook dinner. I've got a 16-year-old who isn't quite getting there, but I think at 16 you haven't quite developed the empathy anyway, have you really? So he is pretty good a lot of the time, but I do have to ask him, whereas my older son will go, well, Mum, you look shattered, do you want me to cook the dinner for you, or can I do this, or can I do the other? So I am quite lucky in that way, and it's a bit of a joke in our family. So I was sitting there going, oh, I'm having a hot one.
But I think that's a great way of talking about it, isn't it? But especially to boys, I've got two sons, and I think that's a great way to approach it with them is, just make it everyday life, everyday conversation. It's not a scary topic that you need to sit them down and say, right, boys, Mum's going through the menopause. It's actually just, it's daily, it's constant, it's relentless, and I need your help. That's a great way of dealing with it. There's still a lot of research that we have to go away and do, and there's still a lot of conflicting conversations. I think there's still a lot of work to be done on research as well, to really find out what's going on. And a lot of the research that I've looked at, I heard a conversation on a podcast that said that a lot of the research is done by men.
Yeah.
Well, hang on a second.
They don't really understand, do they?
A friend of mine suggested a app. I think it's called Balance, and it's led by one of the leading doctors on menopause research, and it's a good tool actually if you want to check your symptoms, or if you want to gather info to go to the GP with.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.